Hello, my name is Dr. Ridhima Banerjee. I am a physician with a special interest in gut health disorders. Today we are going to talk about a fascinating topic and one that I believe is not discussed enough in medical appointments. This topic is: does relationship stress and our social environment have an impact on our gut health? This is what we will look at in today's video. Today's video is divided into 5 parts. First will be a general introduction into what relationship stress actually can include. The second part will include the specific types of stress in one's social environment that can have a detrimental impact on gastrointestinal health. The third part will look at the underlying physiology. Sometimes it's difficult to understand what medical terms mean when one Googles them on the internet. So, in this part of the video, I will break this down into a simple yet an interesting way in understanding how mental health, stress, and especially one's social environment can affect the gastrointestinal system, and how these can arise as symptoms inside your body. In the next part, we will look at what steps you can take to help yourself and to improve your gut health. Today's video will be slightly on the longer side, so I encourage you to take a piece of paper or a notepad and a pen, because in between each part we will pause for a few seconds to give you a chance to write down your reflections and your thoughts, so that it will not be merely a passive watching for you, but also a learning and reflective session. And at the end of the video, I hope that you will have taken away some important lessons and some reflections on what you can do to improve your gastrointestinal health. So, without further ado, let's start. Have you ever felt after an argument with someone, particularly someone who is close to you, for example, a friend, a family member, a spouse, or a partner, that you may have felt your stomach get into tight knots, or you may feel an uncomfortable pain inside and you had to rush outside to go for a glass of water? These symptoms are not uncommon, and this forms the basis of today's discussion. A number of times I have had people come up to ask me whether such symptoms and problems are merely a figment of the imagination. And in today's video, I will attempt to explain why they are not only a figment of imagination, but they do have a foundation in very real science. So, in today's video, we will look at first, what exactly do we mean by relationship stress? A difficult social environment can arise in many ways. When people think of relationship stress or social stressors, it involves a wide spectrum of events. On one end of the spectrum, there are certainly major events such as a divorce or a separation or the death of a loved one. And on the other end of the spectrum are also small but seemingly small rather, but events which actually have a big impact on one's mental health when they take place over a long period of time. These can include living in an environment where one feels constantly criticized or feels judged, or if there is constant conflict in that environment. It can also include emotional or verbal abuse, and people who are caregivers of those who are chronically ill also usually have a significant amount of mental stress. There is compelling research to show that when people live in an environment where there are significant social stressors, that this results in an elevated level of cortisol, which we know as the stress hormone. And over time, what happens is when there is a persistent rise in cortisol, this leads to a process called inflammation inside your body, and particularly the gut. Sometimes I have been asked, what exactly is inflammation? Very simply put, inflammation is the body's internal alarm system. It is the system which the body has designed to respond to external stressors or injury. In other words, an internal alarm system. And you can quite imagine the problems that might arise if the alarm bells keep on ringing for a long time. Towards the middle of the video, we will see what happens when cortisol levels remain unchecked and how this affects your gastrointestinal system, and importantly, how this reflects in the way you find it impacting your health. Now, let's move on to the physiology behind what we are discussing today. And you might wonder, why is this doctor placing so much of importance on mental health and stress and social environment when she is supposed to be talking about gut health? So now in this section, I will explain why I have done that. When you feel a form of emotional stress or emotional pain, this activates the stress response inside your body and your mind. There is an entity called as the HPA axis. For the sake of simplicity of this video, I won't expand on it, but it is sufficient to remember that once this axis becomes involved, it results in the production and elevation of cortisol. And as we saw a few minutes earlier, cortisol is a stress hormone. Now you might ask, what difference does it make that there is an increased level of cortisol in the body? Essentially, what happens in this state is that your mind and body are in a state of fight, flight, or run. And that is not good for your health over a long period of time. In other words, how can chronic stress affect your gastrointestinal system? Number one, it can actually affect the movement of your gut. In other words, it can either increase the movements, which you might feel as diarrhea, or it can even slow down the movement of the gut, which might express itself as constipation. And all these symptoms are a result of the stress response that had occurred sometime earlier. The other way in which the gut can be affected is that it can cause an increased sensitivity of the nerves. In one of my previous videos, I discussed that the gastrointestinal system is very richly supplied with nerves. So it's not only our brains and the spinal cord which have a rich nervous supply, but also our gastrointestinal tract. And it is one of the reasons why when we are processing complex and difficult emotions, that the gut is often used as a way to express those symptoms in our body, sometimes arising as abdominal pain or cramps or even diarrhea. What happens in this case is when there is chronic stress, this leads to an oversensitivity of the nerves in the GI tract. When I say GI tract, I'm referring to the gastrointestinal system. And when nerves become overly sensitive, they can react strongly to even normal stimuli. For example, even if there is a normal movement of the gut, or if even there is a slight distension of the gut. And this exaggerated response is often the reason for the problems faced by certain patients in irritable bowel syndrome. And in medicine, we call this as visceral hypersensitivity. So sometimes when we refer to a person as hypersensitive, we generally mean that they overreact even for small events. The gut is the same way in a person who is suffering from chronic stress. The other way in which the gastrointestinal system is affected is that its barriers become weak. You might have come across the term called leaky barrier in various websites. So in a person with chronic stress, the barrier and the walls of the gut become weaker. Much like the walls that defend a city, if the walls defending a city become weak or become broken in certain parts, it's easy for enemies to come in. In the same way, when the barrier of the gut becomes weak, some of the bacteria toxins that have been contained inside the gut now are able to escape into the bloodstream. And this is what results in inflammation. You remember that sometime earlier we discussed what inflammation is. And inflammation is the body's internal alarm system. So now you can guess what happens when inflammation is set off inside the body. So there are a whole variety of symptoms that can arise from abdominal pain, from discomfort, to weakness. Now, another way in which chronic stress can affect the gastrointestinal system is in changing the microbiome. Now, I have actually discussed and spoken about the gut microbiome quite extensively in some of my previous videos. The gut microbiome is a universe of tiny organisms living inside our gastrointestinal system. And they constitute different types of bacteria and even other organisms. And they are essential for the proper functioning of the gut. However, when there is chronic stress, it can affect the good bacteria inside the microbiome and can lead to the resulting formation of a different kind of microbiome where the bacteria can cause inflammation inside the body. And this has been shown to result in an increased level of anxiety and depression in certain individuals. So, the gut microbiome is an important part of maintaining one's mental health. So, as you have probably heard me say before, there is an important connection between the gut and the brain, which we call as the gut-brain axis or the gut-brain connection. And the microbiome is an important part of this gut-brain axis. So that's a fair amount of information to take in, and at this point of the video I'd like to pause for a few seconds and ask you to jot down what your thoughts are. Do you feel that you are living in an environment which is difficult for you, or which is not conducive for your mental health? And do you feel now, after this discussion, that there is a possible connection between your mental health or your social environment and your gut problems? So I will give you about 3 seconds for that, right? So I'll wait for you. Right. So now so in this part of the video, I'd like to first describe how this can manifest in certain individuals. So if you are living in an environment which is difficult or where there is a great amount of stress, you might experience certain symptoms such as waking up with an urgency to visit the washroom, or you might feel a persistent bloating and abdominal pain. And you might have gone to a number of doctors and done a number of tests without concrete results. So this could be one of the reasons. A number of people have also tried extensive diet changes, trying cutting out gluten and carbohydrate, and also following the low FODMAP diet, and even cutting out dairy, and unfortunately have not seen significant results. And today's discussion may throw some light on why you might not have seen results. For example, if the reason for your gut symptoms or irritable bowel syndrome is mental stress or a difficult social environment or social stressors, then even dietary changes may not play a big role in improving your symptoms. And now we come to the final part of the video, which is probably the most significant for you, and that is, what can you do to improve the situation? And I appreciate that no environment will be perfect, nor will a person's relationships be perfect. However, there are certain steps that you can take to help yourself. The first step is to create an awareness. It is a good idea to take a diary and to note down at what time you feel that you have your gut symptoms the most. You can divide your page into 2 columns. On one column, the gut symptoms, and on the other column, if you note that there has been a particular trigger. For example, did you experience abdominal pain or cramps after an argument with someone, or thinking about a stressful event? And this is very helpful for noticing a pattern in your symptoms. The other step that I can recommend is to try as much as you can to reduce your exposure to such an environment, or even to people who may not be helpful for your mental health. You may not be able to remove yourself completely from that environment. However, you can take steps to protect your mental health. I encourage you to read and educate yourself as much as you can about forming and protecting personal boundaries, and how to handle conflict in relationships. It is also a good idea to educate yourself on certain essential topics such as narcissistic abuse. The other step I can recommend is deep breathing. Now, this has been shown to be helpful for reducing stress, especially when one is not able to remove oneself from an environment which is difficult. For 5 to 10 minutes a day, you can try deep breathing. Inhale for 4 seconds and then exhale for 8 seconds. You can also consider gut-directed hypnotherapy. You can also consider counseling. Cognitive behavioral therapy has been shown to be helpful, and you can also consider going for other forms of counseling as well. The essence of today's video was to emphasize that your mental health, that your social environment, and your relationships with your loved ones and those around you are an important part of maintaining your gut health. You might or might not have access to all of these steps, but I am sure that even following one or two of these techniques will be helpful for you. Remember also that if you have been given medications or diet advice by professionals to improve and to protect your gut health, then please do follow those, and do not discard them without first consulting the physician or the nutritionist who has advised them to you. Please also remember that a regular sleep pattern, a fixed bedtime and a fixed time when you wake up, and regular meals, even if they are small meals, are also helpful. Fasting does not work for everyone, and sometimes it can aggravate symptoms of irritable bowel syndrome as well in certain people. Did you find today's video helpful? If you did, then can I request that you share it with someone who is struggling with gut symptoms and who has perhaps not experienced the improvement that he or she hoped even after visiting medical professionals. They may not have realized that mental health and social environment and relationship stress also affect the gut enormously. If you have any other suggestions or comments or topics that you would like me to discuss, then please drop them in the comment section, and I will do my best to create videos on those. I invite you to like, share or subscribe to this channel, and with that, I wish you a very good afternoon, and I look forward to interacting with you again soon. Thank you and take care.